Hello. The fourth and final major normative theory they're going to be discussing in this class is the theory that is called care ethics or the ethics of care. It's the newest kid on the block, so to speak, and it arose in the 1960s and 70s following trenchant critiques of the earlier three models and their perhaps over reliance on the notion of a rational agency or reason itself. This theory, care ethics, is born from the struggles of feminists and multicultural activists and civil rights activists. And it's also going to be founded in earlier versions of Confucian and African ethics, chiefly arising out of the late 60s and 70s in the work of social psychologists like Carol Gilligan and philosophers like Virginia Held and others. It's going to try to supplant the notion of rational agency over the over reliance of reason and rationality and try to invest morality with a new sense of care. It's going to replace uh, character and rules and outcomes with looking at the notion of care as a good. And it's going to be a little troubling at first to try to get your mind around this notion of care. uh, it's going to be something that requires a great deal of careful thinking, no pun intended, that when you're thinking about the notion of care as the concept of good, we're going to have to rely on a series of terms to try to approximate that. So keep in mind that one of the critiques that arises out of here is that it'd be very difficult to be sort of the completely objective, rational, rule-following agent that Kant asked for. I mean, are there times when one should violate a rule for the benefit of others? Say, for example, is it always wrong to lie? What happens if you have to lie to help a person? And there is a variety of examples within medical care that may require you to actually if not lie, at least to suppress the truth for the benefit of your patient, right? Emergency responders, for example, know that when dealing with, say, a fatality and a relative in a car accident or something, for example. And also, to be sort of this perfect adding or calculus machine of the utilitarian ilk, where you're supposed to sort of just dispassionately discount people suffering and add up the good and the evil, the good and the bad, the pain and the pleasure to others. So, in exchange for those kinds of concepts, they're going to argue that care ethics is going to focus on compassion, solicitude, attention, focus, and these notions are going to be constellated around the notion of care. In Nell Noddings, who did a lot of work in education and is one of the major care ethicists, she will argue that there are two fundamental positions. There's the one caring for, and there's the one that's being cared for. And sort of this dyadic relationship is really central in the notion of relationships itself. And one of the key concepts of all care ethicists is the reciprocal nation of a network of relationships. The way we can think of these are the sort of the ties that bind us. So, in short, you never just have a patient. You have a patient with a history, with a subjective reality that has to really and should inform your clinical practice. What this means is, it's not just going to be, the cardiac patient in room 12, but it's going to be, George Jones, the 74-year-old grandfather and part-time worker at a local museum and maybe a stamp collector and husband and friend and all these ties come in to make that person, and in caring for a person you care for the whole of the person, the gestalt. There are criticisms of this approach, and partly it has to do with sort of later feminist critiques of essentialism, and originally arising out of a lot of nursing ethics. The belief was that women had a greater emotional intelligence, and that to discount those would be wrong. But on the other hand, to suggest that women are only capable of depths of emotional feeling seems to run afoul of the notion that there is a kind of essentialism at play. Nevertheless, and notwithstanding that particular criticism, care ethics has gained ground in modern ethical theory. It will use, instead of these notions of sort of the perfect rational agent calculating rules and ends and means and so forth and so on, it's going to supplant it with sort of maternal metaphors. So, for example, the idea of mother and child, that sort of fundamental nurturing relationship that establishes in an ideal form the notion of care and compassion is what is going to be used as the goal of a care ethicist. So one is going to look at one's patient and pay great attention to one's uh, sets of relationships that inform the identity of that person. Another very important focus is that it has an element of political engagement that other ethical theories may seem to lack. So very early on, the care ethicists will argue that one needs to prioritize vulnerable populations, and these vulnerable populations would be those populations that don't have access to healthcare or, for whatever sets of social conditions, find themselves disadvantaged. And so these might include, and they probably should include, children, women, uh, the disabled, members of minority and marginalized groups who, for whatever sets of reasons, economically, socially, because of implicit bias or outward bias, explicit bias, don't have the same kind of access, and that one's health suffers because of that. And so by engaging uh, medical attention on those, you are going to benefit everyone, because if you sort of, in a way, if you practice this notion of equity, you're bringing up those who are least advantaged or the disadvantaged. Everyone will benefit, is the theory and the approach. Now, what would care ethicists look like in the sphere of medicine? Well, he or she would be someone who would value the person's whole identity. They wouldn't seek profit or policy over the care. They may actually break with decisions of policy and supervisors to provide the kind of excellent care that that particular patient needed. And so it becomes a very challenging position. The criticisms of this model, of course, are similar to the ones that would be leveled against a character-based approach. In fact, some critics argue that it is just a version of a more modern, politically engaged version of a character-based approach. And so these challenges would be that it's somewhat subjective. We don't really know. You can't anticipate the decisions will be made. You could, of course, like with character-based ethics, see a situation or scenario where a caregiver could treat similar cases differently depending upon some factor that the person wants to prioritize. So a way of sort of thinking about care ethics is to think about the concept of care and what care means. And of course, you'd have to think about sympathy and empathy and compassion and attentiveness as very important aspects of that. So in the next short lecture, what we will do is actually we will review all four of the major normative theories: the virtue-based, the principle-based, the outcome-based, and then, of course, most recently, the care position. And then I will provide a case study that should assist you in uh, deciding which of these theories you operate with. Okay, enjoy, and see you next time.